Last winter, in his State of the Union address, President Obama announced a federal commitment to conquer cancer, similar to the effort made in the 1960s to put Americans on the moon. Well, what does the cancer moonshot, coordinated by Vice President Joe Biden, really mean in the battle against the disease? We asked Dr. Wilson Mertens, Medical Director and Vice President for Cancer Services for the Bay-State Regional Cancer Program, for some of his thoughts on the massive project.
Since President Nixon's war on cancer in 1971, we have not had a real strong, rejuvenating commitment to cancer. And while the war on cancer gave us a renewed National Cancer Institute and clinical trial cooperative groups that have made a tremendous amount of difference in refining and defining new cancer treatments, the chassis has grown old and stale. And in fact, many of the modern successful practice-changing clinical trials are actually being conducted around the world outside of the United States. And so my hope for the moonshot is not just an influx of dollars for researchers, that is of some importance, but it really is to take another look at our cancer research infrastructure and our cancer delivery infrastructure. And certainly a part of that is part of the Vice President's vision.
I know Vice President Biden said one of the things he learned in his son's illness was the unbelievable amount of information that is out there. And I know you've talked about this too, how much research, how many papers are being published, not every year, but every day around the world. And I mean, it's something you try to keep up with. Very, very hard to do.
It is, and I think that you can distinguish between data and information, and I don't know how much of the data that we have is actionable information. And so part of the moonshot is to once again put some focus on big data, the thought that we will take all sorts of information, collate it, compute it, and potentially out of that get some answers, which will be very dependent on what kind of algorithms are used. And I certainly, that will give us a fair amount of demographic information and perhaps disparity information. Will it lead to cures? I'm not sure. I think the big investments will be, can we change our clinical trial infrastructure? Can we bring these new, very promising drugs to market more quickly? And then we have to look at our delivery system. Once we have these cures, can we afford them? Are they being delivered with rigorous accuracy? Are we avoiding waste so we can treat as many patients as possible? We actually have data now that perhaps a third of patients who have chronic myelogenous leukemia, a disease that can be controlled for years, if not longer, with a small pill, are not taking that pill because of cost. So we're not going to fix the cancer problem in this country if we have cures and treatments that are not deliverable because of poor delivery systems or because of cost and insurance issues.
In the official announcement from the White House, they said we're at an inflection point and the science is ready for this kind of concerted new effort, the $1 billion. What does that mean? Why is this particularly a good time, if there's ever a bad time, but is this particularly a good time to be going at cancer in this way?
I don't know. I think that the inflection point reflects the knowledge of molecular therapies, the human genome, better understanding of the basic science of how cancers develop. And yet, even though it's relatively early on in this molecular era, we're getting the sense that there will only be so many opportunities to look at specific molecular targets that can turn a cancer around. I do think that we know a great deal more about cancer. I think that we have, in a way, and I don't think the White House intends it this way, we have an inflection point in terms of crisis in our healthcare system, in terms of cost containment and quality. Will we have the political will, even more than the money, to restructure our cancer treatment enterprise, which in this country looks very different from other countries? I think that political will is going to be at least as important as the financial investment.
Can you explain that? How we're different in this country from other countries? Are we different good or different not so good?
Well, I think it's just different, and it's probably plus minus. On one hand, we do have a very distributed cancer care model where every insurance company, seemingly every hospital has a cancer program. That's not the case in most countries where there is more consolidation of expertise and resources to deliver high quality cancer care. Mind you, we're not the same as European countries where population is spread out, so there are limitations to what we can do there. We have a clinical trial mechanism at the federal government level that covers multiple diseases in each one of these organizations, whereas the Europeans have really moved to national studies focused on a disease where there's real expertise, developing clinical trials that answer critical, important questions. Those are just a couple of differences that I think distinguish our cancer programs from other nations. And I think learning from other nations might be of some benefit.
Realizing there are hundreds of forms of cancer, there is basically a cancer, at least a cancer, if not more, for every part of the human body. Do you envision a time of cures and or treatments, as you've already mentioned in a couple of cases, where cancer will be, if not curable, chronically treatable for maybe long periods?
Well, I think by growing proportions, yes. But if people are looking toward a moment where cancer will be, in a way like HIV has become, rather than a death sentence, a manageable and sometimes a very effectively managed disease. I think we're going to have to wait a very long time for that, and probably never. There are not that many breakthroughs for cancer. Some of the immune therapies now are game changers, but those come once every 5 years or so, and they're hard-fought victories. The federal government's suggestion, the Vice President discussed this, making investments so that we have accomplishments in 5 years as opposed to 10 years, do it in 5 rather than 10, is very compelling. But how do you measure that? And this is such a long distance run. What I think we can say is that we are so much better at treatment and diagnosis now than we were 5 years ago, 10 years ago. Diseases like lung cancer, myeloma, melanoma, those treatment algorithms are completely different than the way they were 5 years ago. And that doesn't speak to small changes. That really is a thunderclap. We just haven't had that across the board. So I think we will continue to have victories, and there will be continued good news. But I don't think there will be a time when cancer will be completely vanquished. We will have to have peaceful coexistence.
Dr. Wilson Mertens, thanks for your time, sir.